Good morning, everyone. We still got a couple people trickling in, but thank you so much for being with us today. And with the flexibility of shifting this meeting, we had a couple other, statewide and large meetings that conflicted on the 16th. So we just pushed it slightly, and glad that you were able to still make this time work. I know it is still Memorial Day week, so there might be a couple people out of the office, but we appreciate the opportunity to share updates with you all at the end of the month here, and we'll take any questions. We had a couple come in during registration, so we can start with those during Q&A, but I do encourage you all to chat in your questions throughout as we go, and we can turn to those during the Q&A session also. As usual, lines are muted, but the chat is accessible to everyone, so please feel free to use that throughout today. As normal, we have Senior Deputy Commissioner Veronica Judy Cecil with us today to share information, updates, status of how things are going. We have gotten pretty far through the unwinding and working through those last months and those last renewals of PHE unwindings, but doesn't stop there because now we're back to normal. So we can speak to that and share information about sort of that expectation as well too. But thank you everyone for being here again. And Veronica, I can turn it to you to get us kicked off.
Wonderful. Thank you, Helen, and welcome to everyone. So appreciate you taking the time to join us today, knowing everyone has a very busy schedule and lots of things that, fill up your day. So thanks for taking the time. As Helen mentioned, we never thought this day would come, but it has. We are starting to wrap up the unwinding of the public health emergency. This, in fact, I believe, if I'm correct, is our 14th stakeholder meeting as a result of the unwinding. So appreciate all those who have joined us every month or gone out and watched the video if you weren't able to join us live. We do plan to continue the stakeholder meetings, but we are going to do a shift starting in July. We'll still be providing an update on renewals, so that will always kind of be a subject matter on the agenda. But we want to continue these meetings going forward to also provide other Medicaid updates. So starting in July, you may see a shift in the content of these meetings going forward. But again, if you're interested in still finding out what's happening as we come out of unwinding, that information will be available. So I am going to turn off my video as I share the slides because I look on a different monitor. So I will do that now. Okay. So one of the things we just remind folks is we did put in a lot of different flexibilities as part of unwinding. As you know, we did a lot of flexibilities during the public health emergency, and then CMS, the Centers for Medicare and Medicaid Services, allowed us additional flexibilities as we started to return to normal eligibility enrollment activities. So starting because of the requirement of the Consolidated Appropriations Act of 2023, we were required following March 30th to have to start doing return to renewals, which we call renewals as part of the unwinding or PHE or Public Health Emergency renewals, because it is the first renewal following the public health emergency that someone has had to go through. So we implemented a very long list that is on our website. If you really haven't checked it out, please feel free to go look at that. The ones on the slide here are the ones that were sort of the last ones that we implemented and are continuing, to really make a difference over these last couple of months. One of those was redistributing some of the renewals to May. We originally were going to go through April, but we did redistribute about 34,000 renewals into May as we continue to try to manage the workload. And That is why we still have some PHE renewals in May. We did, I think, probably one of our, what I would say, most effective flexibilities was suspending child renewals. That's that top left box there. We did, starting in October last year, automatically renew children. We did that because we had we asked for that flexibility because we had such a low termination rate for children prior to the COVID public health emergency, and we wanted to be able to relieve the workforce workload in order to really focus on those renewals that take additional time, like our long-term care and 1915C home and community-based waiver renewals, because there's a lot more, it's a more complex eligibility determination. So CMS, we were the very first state to make this request and granted the flexibility to just automatically renew those children without them having to go through an actual active renewal. Then as we continue at the end of the month, if someone hasn't responded to a notice, we can extend them for an additional month so that we can conduct outreach to those folks. That's that bottom left bucket there, and that gives us additional time and the member additional time to respond to that notice and provide us the information that we need to make a redetermination. And then that last bucket there on the bottom right that we just like to highlight is we do the same kind of extension for those who haven't responded to a notice, but for long-term care and waiver members, we are able to extend that up to 3 months. So they have up to 3 months additional time if they've not responded to the notice. The other the news that we have available is that CMS just recently issued guidance that is allowing states to extend their flexibilities to June 30th, 2025. So that means the flexibilities that were originally for just the PHE renewals are now going to be permitted for all renewals as we move out of unwinding, and Kentucky will continue those flexibilities as well. I do want to mention that the child renewals is under consideration separately by CMS because it was a very different type of flexibility that was requested by Kentucky. So we're working with CMS to request that flexibility also extend, but we'll keep folks updated on those conversations and the outcome for that. As of right now, we do plan to extend child renewals as well. Also, just a reminder for those in our home and community-based service waivers that we did have separate flexibilities to the Appendix K for them. We did go out and amend all 6 of those waivers and made permanent some of those flexibilities, and all those were approved effective May 1st. If you need more information about that, again, lots of information out on our website. If you have a question about a specific case, that top right box there shows both the email address and phone number. We understand, that this transition takes time. So some of the implementation of the permanency of these flexibilities, we're working with providers and members and families to be able to transition with those amended waivers. So definitely, if you have questions about a specific case, please reach out on that. We made you all aware a month or 2 ago on a couple of different populations that we've made some different process changes for. The first one I want to mention are for the SSIR population. We decided we paused terminations for SSI, and just to remind folks how that process works. The Social Security Administration sends the state Medicaid agency a file, And that file tells us whether or not somebody has lost SSI. And if somebody is in Medicaid, just based solely on the fact that they have SSI, so they are conditionally or categorically eligible because of that, then we are required to also terminate them, but also determine if they might be eligible in another type of assistance on another basis. So we decided in working with CMS, we made some changes to our process. So now we get that to implement this, we paused all SSI terminations as of February 16th and kept those members eligible. And then we worked on a system change. And you see phase one there, we implemented on April 26th. And so now what happens is anyone, if we get that notice of termination, SSI termination from Social Security Administration, we will now give that member 2 full months of eligibility and send them a pre-populated renewal form to give them an opportunity to provide information to us so that we could determine them on another basis. Keep in mind that we don't have a lot of information on these folks because their eligibility is driven by that enrollment in SSI. So we need information that we don't have available to us through our data sources to provide that information from the members so we can determine them eligible. As part of this, there are certain termination codes from SSI that were already given a 2-month eligibility period to provide additional information. We've now expanded that to other termination codes. The exception to that is if we get a report of death, we get a report of somebody moving out of state, or if somebody, I'm trying to think of the other termination code, but there's about 3 that will still result in the termination of a member because we're not allowed to continue it. The other problem that I think folks were encountering that we discovered is that someone who does terminate from SSI in our system was not able to go out to the self-service portal through Connect and reapply so that they could potentially get determined eligible on another basis. There was a system change that had to happen that now allows somebody that opportunity to go into the self-service portal and reapply through that mechanism as well. The second phase there you see that will occur on July 19th is updating our process based on CMS guidance that once a member who is going through this process has been determined ineligible, we are required to act on that determination immediately. We can't just wait until the end of the 2-month period. So we're making system changes to ensure that that happens. And then the other piece to this is a new Salesforce campaign. Salesforce is what we use to go out and do outreach through text and email, and so we're and phone calls, and so we're updating that campaign going forward so that individuals that fall into the SSIR termination can get these outreach notices when previously they were not receiving them. So for those individuals that were paused, that last bullet there, we did go ahead and take those individuals. We've sent them a form and asked them to respond, and those individuals were split between May and June renewals. The other population I wanted to provide an update on are individuals that through May of 2023 and January 2024, we went out and checked the trusted data sources, and the information that came back let us know that the member's income was no longer eligible for Medicaid, and so they, what we call, cascaded down to a qualified health plan advance premium tax credit eligibility. And what that means is APTC, advanced premium tax credit, is a way to it provides financial assistance to make qualified health plans more affordable. So it could either, based on somebody's income, could either make that premium zero or very low, to make it more affordable for that member for an individual to sign up for a qualified health plan. So we cascaded folks to that qualified health plan APTC eligibility and sent them a notice terminating Medicaid. In that notice, we did tell them that this was based on the income information that was available and to report changes to us. But what we now are doing as part of this effort is sending them an actual renewal packet and giving them at least 30 days to respond to that renewal packet to see if there's a change in circumstances that will allow us to find them eligible, to still find them eligible. So to implement this, we did go back and reinstate folks. And we've got 3 buckets here. That first bucket, terminated and did not enroll, means we terminated an individual and they never came back to Medicaid. So they never attempted to apply to Medicaid again. They also did not go out and enroll in a qualified health plan, despite the notice telling them that that is available to them. We reinstated that entire period of time from April back to their termination month. So if they were in May 2023 and terminated, we reinstated them back to that month. And then we sent out a renewal packet. We split the population and sent half the population a renewal packet to go through a renewal in May. And then the second population is going to be receiving theirs this week to perform a renewal in June. The second bucket there is terminated and re-enrolled. So these are folks who actually did come back into Medicaid at some point. They provided information to us and we were able to determine them eligible. So what we did is we've reinstated any gap from the date that they were originally terminated from Medicaid as part of their original renewal month and the re-enrollment date. And these folks do not have to go through another renewal because they took action. We were able to perform a redetermination, and they are currently enrolled. And so there's no need for them to have to go through a renewal. The third bucket there is terminated and enrolled in a qualified health plan. So we did have folks after receiving that notice that went out and at some point enrolled and chose a qualified health plan. And so what we've done for these individuals is we have filled any gap from their month of Medicaid termination to when they enrolled in a QHP. And we've also sent an outreach to them saying, if you feel like you might be Medicaid eligible, here are the ways that you could reapply for Medicaid. But they are covered through a qualified health plan. The one thing I do want to note for all of these buckets is that we did reinstate them to fee for service. So they may have had managed care until that original Medicaid enrollment and Medicaid disenrollment, and then they will have fee for service during the gap period that we reinstated them. If they return to Medicaid, they will be put back into a managed care organization. So for example, that middle bucket where they did re-enroll, the gap between their termination and re-enrollment is fee for service, but they are now back to managed care, and prior to that they were in managed care. The reason we did that is so that we could pay any claims during that period of time and work with providers if the member did seek services, and we certainly don't want them to have to pay for any healthcare services provided during that period of time. So the change to actually drop these individuals to an active renewal and send them the renewal form started in February. So from February on, we have been going through this process of giving them that opportunity to complete a renewal packet. Now let's shift to what our current Medicaid enrollment looks like. So as you can see, we just recently did an analysis and we're, excuse me, fairly on track with what we predicted as part of unwinding the number of individuals that might be disenrolled. And we did that by, at the very beginning of unwinding, our system going out and doing an attempt to find someone eligible, and throughout the public health emergency continued to do that, but we just suspended obviously any terminations as a result. So by the time that March of 23 came around, we were able to really kind of glimpse into a snapshot of the population and see that we had about 234,000 at the time that were going to no longer be eligible for various reasons. So as we see, the numbers trick down, and we did have a little bit of a leveling off. And some of that was ways that we were able to maximize passive renewal. Passive meaning we went out and checked the data sources and were able to determine them eligible. And so they didn't have to take any action. That's called a passive renewal. So you can see that we leveled off quite a bit. And then that recent bump is really just, again, some of the flexibilities where we can only extend somebody a month or 3 months, depending on the population. At some point, they will drop off and terminate if they've not responded to that notice. So that's what you're kind of seeing as that little decline that's happened in the past month. So this really busy slide, if you've been on previous calls, let me just, though, take a minute to explain to anybody new. So we are required by CMS to file a monthly report. It's due on the 8th of the month, and you're reporting on the previous month's activities with the renewal. So how many were approved, how many were terminated, and in those approval and termination buckets, how did they get processed? So again, could be our passive renewal. So we were able to go out and ex parte or passively renew them. Or, it could be a procedural termination where they didn't respond to a notice. So what you see here on the left-hand side are those original CMS monthly reports that we've been filing. Then in October last year, CMS asked states to start reporting a 90-day processing period following a renewal month. So on the 15th of the month following a 90-day period, we are to update information based on pending cases that were processed. So you see in the middle column there is the 90-day processing period and the actual number of pending cases that were processed. And on the right-hand side is our updated CMS monthly report that reports that information. So let's take, for example, the kind of the most recent one, which is January. So on February 8th, we reported in January on the left-hand side in our original CMS monthly report, we had 79,053 renewals. And of those, we approved 67,748. We terminated 10,861, and we reported 22 pending cases. So we had 22 pending cases that we needed to report back to CMS on the 15th of the month following the date, the original renewal month. So on May 15th, May 15th, we reported that we processed all 22 of those pending cases, And then you can see on the right-hand side, our approvals and termination numbers have changed accordingly. So these are all out on our website, as you might be interested to go back and see what happened in previous month with pending, that's all on there. And we've got this snapshot that kind of makes it a little easier to see. Now focusing on our more recent months that are going through renewals. We do not have May yet. We have one more day in May before, May renewal terminations would happen. So we'll have those for you all for next month. But our most recent month, again, is April. Just reporting the new numbers. So we had 103, 265 renewals. We approved 70,170 of those. We terminated 8,416. We had pending, and just again to reiterate, pending means that someone has returned information, but the state has yet to process it when the renewal date crosses over. So for April, that means on April 30th, if the case was pending state action, they get put in a pending bucket. And these are individuals whose eligibility should be extended. Sometimes the system, isn't 100% perfect, and we find folks that kind of fall out of that. And if you have someone that's in that situation, you should always escalate that up to us so that we can make sure that it's being processed correctly. But we had 226 pending, and that extended bucket is those two extension flexibilities I mentioned, the 1 month and the 3 month. So we had 16,982 extended from previous months as a result of that. And then we've been tracking reinstatements, which is that far right bucket. So anybody who comes back in and responds to that notice. So let's say they were terminated because they didn't respond to a notice, and within 90 days following the termination, they provide the information that we need. We are able, as part of our flexibility, to reinstate that person back to their termination month as if there was no gap in coverage. So we track those 90-day reinstatements. And as you can see for April, we've already reinstated 2,332 folks. I do want to mention that we have some surveys out there. We are trying, as part of really focusing on the activities that have happened as part of unwinding. We wanted to engage stakeholders and members about the experience that they had. So we really want this to kind of inform as we move out of the public health emergency unwinding and into really the new normal of eligibility enrollment, to see how were people getting information and how effective was it. And so we can continue we really want to continue some of our really, I would say better working initiatives, and especially around communication, and maintain those as we move out of unwinding. So there's currently any member who went through a renewal has received a email directly to them. We understand that there are some members that might not get that because they don't have an email, but we had to be able to control the group to ensure that it's only a member that is responding to that. So we did send that by email to Medicaid members directly, and hoping that and encouraging them to respond to that survey, so we have the benefit of their experience. And then we have the stakeholder survey that is open to anyone. We really want providers, advocates, family members, anyone who helped help members understand about the public health emergency unwinding and the restart of renewals. Anybody who's been interacting with unwinding to take that survey. So If you haven't yet, really encourage you while it's still out there. We're going to, I think, have it out until like mid-June to please do that. We have been working for several months on a Spanish version of both, and we keep being told it's going to be ready any day. Once that Spanish version is completed, we're going to resend it, the survey to our members, so that, if perhaps they did not understand the email that was sent to them originally, they will have the Spanish version to assist. We always have a plug for our informational flyers that are out there available. We created these specific to Public Health Emergency Unwinding, but I can assure you that many of them will be relevant as we come out of unwinding. They're about renewals. That's not going to change. The process isn't going to change. So these can still be utilized for our members, for providers, for advocates, for anybody who is still trying to assist a member. And the reinstatement, the 90-day reinstatement flexibility will continue. And in fact, is now part of a final rule that will require permanent implementation. So it's very relevant to continue to remind folks that if they just received a termination notice and they're in that 90-day period, if they could just contact us and report the information, then we could redetermine them and do that retro 90-day reinstatement without them even having to request it. So this information, I think, is still very valid. And then as we come out of unwinding, we're going to continue to look to see what information is really helpful to everyone, both members and those who are supporting members going through renewal. So we're still very open to creating new flyers if they are going to be of help. So don't hesitate to reach out to us if you have an idea of one that we could prepare. As I mentioned in a previous slide about a qualified health plan, we're monitoring that as well, because we do hope that members who are determined and eligible move over and choose a qualified health plan if they don't have coverage, maybe through their employer or through some other source. So we've been tracking qualified health plan enrollment along with Medicaid enrollment. And as you saw the decline in the trend for Medicaid enrollment, you will see that we're very happy to see that there is an also increase in enrollment for a qualified health plan. So as of May 20th, we have 79,202 enrolled, which again, we're really happy to see that number. We are one of our goals throughout unwinding is to connect members to other coverage if they're not eligible for Medicaid. So this has been an important metric for us to follow. And just one thing to note on qualified health plan open enrollment. So there is a specific open enrollment period for the qualified health plan, but if you are terminated from Medicaid, that is both a qualifying life event. However, there is a special Medicaid open enrollment. So any person who has been terminated from Medicaid all the way back to March of 2023, anybody who's been terminated from Medicaid can go out and choose a qualified health plan and does not have to worry about either the period of time following a qualifying life event or an open enrollment period, because the special Medicaid termination open enrollment allows them at any time to go out and enroll in a qualified health plan. They just have to check a box that they were terminated from Medicaid, and that allows them to do that at any time. So just a reminder of our website, lots of information. Those CMS monthly reports are out there, the flyers, a recording of this is out there. And so please feel free to take advantage of any information's out there. Those flyers can be utilized by anyone. You can pull it down, you can copy it, you can distribute it as much as you want. And then, throughout this, we've encouraged folks to either follow us on social media, so Facebook, Twitter, or Instagram. You don't have to do all three. We generally do the same information across all three platforms, but, like us or follow us on one. Even as we come out of unwinding, it's going to be a great way for us to continue to communicate around renewals. So it's not too late to join one of those and follow us so that you can stay on top of the information. I mentioned we're going to continue stakeholder meetings. So next month, we'll still focus on the unwinding. And then in July, we'll shift to doing it about other Medicaid updates. And then we always try to remind, especially our providers out there, that Kentucky Health Net, which is the system that they can go into and check Medicaid eligibility, does have the renewal redetermination date on there. And then for long-term care providers, they can go through CLOCS, the Kentucky Level of Care System. And for 1915C members, it is in MWMA is where they can find the member information. And now I will stop sharing and come on camera, and happy to take any questions.
Thank you, Veronica. That was extremely helpful to see. We did have one question come in during the chat that I wanted to raise first, and I believe came from Priscilla. So Priscilla, if I'm incorrect in this tracking the time that it came in with what Veronica was talking about, let me know. But she was asking for the APTC reinstatements. You mentioned those three groups. Do you have a sense of numbers or an estimate of how many people would be in each of those groups that you could share? Might not be off the top of your head, but
yeah, I was going to say it's not at the top of my head. And so what we'd be happy to do is post something with a response to those questions.
All right, great. Another question that came in during registration was about the document processing task. So this participant had flagged that a couple members, when they come in and submit documents in person to DCBS, it's not getting processed into their account so that the system doesn't show them as pending, and therefore some coverage is being terminated in error, since they did come in person. So I know that this is something that we've shared with DCBS, but I just wondered if you could speak to the process or the steps in place to try to mitigate this instance.
Yes, absolutely. And honestly, if we could get real examples of where this happened, that allows us to track it through the system to see if there's something else that's causing a problem. But the way the process is supposed to work, if somebody submits something by the end of their renewal day, so for example, May 31st, if someone even walks in tomorrow and submits documentation, the system is supposed to flag those folks and find them and extend their eligibility as a result. So there's obviously a system problem that we see from time to time, and that's why I mentioned it. That for whatever reason the document task is not extending eligibility. So it's important to escalate that to us, and real world examples helps us make sure that it's not something else that's happening with the system. We will go back and reiterate to DCBS workers that, make sure that when somebody's coming in, that's getting uploaded immediately so that it can cause that, that's automatic system to extend the eligibility while it's pending.
All right, thank you. That's helpful to know. So if there are specific instances, please feel free to send those in to us and share more information, and we can track this down. But it is, as something we're aware of and taking steps for. So I don't see any other questions coming into the chat. Let me double check here just to make sure I'm not missing anything. But are there other questions from those on the line? Don't want to move too quickly. All right. Not seeing any come in and not seeing anybody typing in there. So I think that's really all that we've gotten today. But appreciate everybody taking the time to join us and to raise these questions, hear the updates, and we will be back to our regularly scheduled timing next month. So that actually means that we'll have the next meeting in just about 3 weeks. So we look forward to seeing you there. We'll get that registration available online and out via email through the cabinet's messaging pathways. So look for that, and appreciate everybody taking the time today, and have a great rest of your Thursday and enjoy the weekend.
Thanks, everyone.
Thank you.